Hey everybody, welcome to Pick Dr. Osborne's Brain. Got a great show for you today on diabetes. We're going to be doing a deep dive. So if you struggle with ups and downs in your blood sugar, hyper or hypoglycemia, diabetes, or you've got questions related to blood sugar issues, stick with me. It's a first come, first serve basis. So if you've got those questions, type them in now. I'm going to do my best to get them answered before we wrap this show up tonight. And stick with me to the very end because I'm going to be talking about all things diabetes, including the key nutrient deficiencies that if you have can actually make it impossible to control your blood sugar regardless of how well you exercise or how well you eat. So stay with me all the way to the end. I've got a special nutrient bonus for you in tonight's show. So let's dive in. All about diabetes. So if we look at the kind of just the incidence of diabetes, now this is becoming more and more, I won't say popular, I'll just say prevalent in the US, and this is really globally across the world in industrialized countries, we're seeing these same types of trends. But you can see here 26.9 million Americans have been diagnosed with diabetes. Now let's get clarity. This is type 2 diabetes, okay, that we're referring to. We're not talking about here type 1 diabetes or latent adult autoimmune diabetes. We're talking about type 2 adult onset diabetes, 26.9 million. That's approximately 8.2% of the population. And this is coming directly from the National Diabetes Statistics Report published in 2020. So this is relatively new information based upon this year. Now we know, like for example, in schools, today, we're seeing a lot more children develop diabetes. As a matter of fact, there is a symptom that nurses are taught to look for in children in grade school. This symptom is called acanthosis nigricans, which what that is, it's a Latin term that means dark or blackness in the neck. And so what happens is in the fold of the neck, right in the fold of the neck, when you bend your neck backward, that skin becomes very rough and very dark, almost like an ashen or gray, and in some cases, depending on your skin tone, almost black in color. And so if you see this in your children, this dark swath on the back of the neck, definitely is something you want to do is get them into the doctor and have that looked at and have them tested for diabetes, because you don't want to let a blood sugar issue get too deeply entrenched or too deeply enrooted, because it can create a lot of problems. Now there are different types of diabetes, and I think it's bearing worth mentioning. There's what most of us are familiar with, which is type 2 diabetes. This is oftentimes referred to as adult onset. Let's change our color here. There we go. Adult onset diabetes, and then there's type 2 diabetes, which is generally in younger individuals. This is oftentimes was called juvenile diabetes, but most formally type 1 diabetes. And then there's another form, and this is autoimmune disease here. So type 1 is an autoimmune attack on the pancreas beta cells, whereas adult onset is different in its mechanism. And then we have what's oftentimes referred to, it's not on here, but we have what's sometimes referred to as LADA, latent adult diabetes, autoimmune diabetes. And so this kind of really, in my opinion, really falls more under the type 1 diabetes, although some people call this diabetes 1.5. And so, again, my personal opinion and professional opinion is that there's not much of a difference here other than the age at onset. They're pretty much the same condition, the same mechanisms of action underlying. We'll talk about that shortly. And then there's also what now is being called diabetes type 3. So type 3 diabetes or Alzheimer's. You know, a lot of folks don't realize that Alzheimer's disease or dementia is now, in the research, in the literature, is actually being shown to be, in many people, a blood sugar problem. So think of, whereas diabetes, type 2 adult onset diabetes, is something that predominantly is insulin resistance. This is insulin resistance to the brain itself, and so we have memory or dementia type issues that can begin to develop. And then there's gestational diabetes, which is the diabetes of pregnancy, which is largely the same thing as adult onset diabetes. It's just that this occurs rapidly in pregnancy for the same reasons that we might see type 2 diabetes develop. So let's talk a little bit about some of these differences. So let me move that arrow out of the way. So with type 2 diabetes, you've got food that contains glucose, or it's converted, the food substrates are converted into glucose, and then that sends a message to the pancreas when that glucose gets into your bloodstream, and the pancreas will produce insulin. And that insulin then will open the cells. Think of insulin as a key, if you will. It's a key that opens this special door on the surface of our cells, including our muscle cells. And when that key unlocks that door, glucose, as you can see here in this little blood vessel, glucose comes into the cell, and it helps that cell generate energy so that it can do what it's supposed to do. So in this case, a muscle cell is supposed to contract or relax, and it needs lots of energy to do that, and glucose is one of the energy substrates that helps that happen. What happens in type 2 diabetes, though, is over time, people become resistant to insulin, so their key starts to change. And if you've ever had like a key that didn't work quite as well, you put it in the keyhole, and it won't quite open the door, and you have to jiggle it a little bit to get that door to unlock. This is kind of like insulin resistance. Because the key of insulin doesn't work quite as well, so you have to jiggle it a little bit, molecularly speaking, and so it makes it less efficient for this process to occur. And we're going to map this out in detail here shortly, and we're going to talk about all the nutrients that play a role in this, so stick with me. But I want you to understand the concept. Insulin resistance it generally occurs as a result of either abuse to the body of the wrong food, not adequate exercise, malnourishment, or inflammation, chronic inflammation. So we'll dive into that here in just a minute. And by the way, those are all, that's why we call type 2 diabetes a lifestyle choice. I know many of you are getting mad at me right now. I can just see your head steaming as you're sitting and watching. How is type 2 diabetes a choice, Dr. Osborne? It's a choice because you can change your food, you can choose to exercise, you can choose to get the right nutrients in your diet, and you can choose better behaviors that create less inflammation. And so in that regard, it largely is a choice. Whereas type 1 diabetes, less of a choice. This is more of an autoimmune condition, not more of an autoimmune condition. It is an autoimmune condition. And so what happens here is your pancreas starts to become damaged. You actually produce antibodies against the beta cells in the pancreas, and the beta cells in your pancreas produce insulin. And so when your pancreas is damaged, it produces little to no insulin. And so that sugar, you still have it. That sugar's still in your bloodstream, but it doesn't have a great way to get into the muscle cell. It's blocked because there's not enough insulin. So there's no key to open the door of your cells to allow glucose to leave your blood and go into your cells to make energy. So the glucose gets trapped in the blood. And this is why with type 1 diabetes, people are insulin dependent, oftentimes have to go on insulin as a medication. And so we see the same thing in LADA or in diabetes 1.5. Again, it's a latent adult onset autoimmune diabetes, whereas this type 1 is classically considered happening in kids, younger children. But again, the same premise in that this is an autoimmune condition. Now, there's some research that shows that gluten can speed this one up. Gluten can actually increase the risk for developing type 1 diabetes, and there's really some good research on pregnant women who are gluten-free. Their children have much less risk of developing type 1 diabetes than women who eat gluten during pregnancy, and I'll show you that here in just a minute, but I think it's worth mentioning. And then over here we have gestational diabetes, and I'll point a few things out. Gestational diabetes, as I mentioned a minute ago, is very much the same type of process here as type 2 diabetes. And the danger with the gestational diabetes is the baby, because of the extra sugar, the baby can get too big. Okay, and when the baby gets too big, it can create pregnancy complications through birth, right? If that baby gets too large. A lot of times when women go to their OB-GYN and they're having their regular checkups, the doctor wants to do what's called a GTT, a glucose tolerance test. And that test is where they give you this sugar water to drink, and then they collect your blood for several hours after you drink that, and they're measuring your blood sugar. And this is one of the tests that they try to use to help you understand whether or not you have gestational diabetes. Again, this is just an opinion. Don't construe this as medical advice. My opinion, this test is worthless, because whether you do or whether you don't have gestational diabetes, ultimately you should be eating premiumly well during pregnancy, so you shouldn't need a test to tell you to eat better to take care of your baby. So if you want to avoid diabetes during pregnancy, again, you shouldn't be eating that way even when you're not pregnant. That's just my opinion. But eating inflammatory, high sugar foods, lack of activity even during pregnancy. A lot of times we want to handle pregnant women with like this dainty attitude where because you're pregnant, you shouldn't walk, you shouldn't do things, you shouldn't stand for too long a period of time. And my advice is that pregnant women should stay as active as their body allows them to stay during pregnancy and not lean on everyone else. And that, again, this is no accusation to any of you in particular, but I see it a lot where doctors tell pregnant women to take it easy, and husbands tell pregnant wives to take it easy. And the reality is just because a woman is pregnant, she doesn't necessarily need to take it more easy. Now, should she go and try to do heavy weights and heavy deadlifts and things of that nature? No, but she should live and try to live regularly, because a lot of times that gestational diabetes, it comes in as a result of inactivity or as a result of less activity. So that, remember, part of how we control blood sugar is muscle, right? And one of the things that causes us to lose muscle mass is inactivity. So if you're being inactive during that pregnancy, your muscles are actually starting to shrink, and your blood sugar can actually go up. And if that's what doctors are trying to call gestational diabetes after they've told you to take it easy, you can see where the advice could get a woman into trouble. So again, if you're pregnant, doesn't mean you necessarily need to take it easy and lie in bed or lie around trying to protect, the delicateness of the baby. The baby inside of you that's growing is going to be just fine if you try to stay active during your pregnancy. So again, be careful around that, because you could actually, through inaction and through inactivity, you could actually cause some major issues. I mentioned a minute ago gluten and diabetes. There's a lot of relationship between gluten and diabetes, and that's both type 1 diabetes as well as type 2 diabetes, as well as gestational diabetes. So there's a connection with gluten and all different forms of diabetes. So I want to draw your attention to a few things that we know. Number one, we especially know this with celiac disease, but the comorbidity of type 1 diabetes with celiac disease has been attributed to genetics. In essence, the same gene pattern that contributes to gluten reactivity is the same gene pattern that increases the risk for the development of type 1 diabetes. We also know that type 1 diabetes rarely develops after diagnosed celiac disease, and here's why. When celiacs get a diagnosis and they go gluten-free, their gluten-free diet reduces their risk of further developing or going on to develop type 1 diabetes. And so, again, a gluten-free diet largely very helpful. We know that 10% of patients with type 1 diabetes develop celiac disease. So what did I say a minute ago? People that develop celiac disease and go gluten-free rarely develop type 1 diabetes, but people with type 1 diabetes, so in essence, if they got their type 1 diabetic diagnosis first, many of them, 10% of them, go on to develop celiac disease. Again, there's this association between both of these conditions, and it has to do with gluten triggers autoimmune reactions. So in celiac disease, the autoimmune reaction is in the GI tract. In type 1 diabetes, the autoimmune disease reaction is against the beta cells of the pancreas. So studies indicate a link between gluten-free diets and reduced incidence of obesity. And this is, again, obesity is one of the risk factors for type 2 diabetes, okay, as you see here. So again, gluten-free diets reducing the risk of obesity and the development of type 2 diabetes. Gluten-free diets also shown to reduce the development of type 1 diabetes. Let's pull this image up here. This is a research study here recently published. Just read a few things to you. Possible prevention of diabetes with a gluten-free diet. Again, quoting from the study, interestingly, animal studies and a human study have demonstrated that a gluten-free diet during pregnancy reduces the risk of type 1 diabetes. Some studies have linked intake of a gluten-free diet to reduced obesity and type 2 diabetes, and has suggested a role in reducing leptin and insulin resistance and increasing beta cell volume. The current knowledge indicates that gluten, among many environmental factors, may be an idiopathogenic factor for the development of type 1 diabetes and type 2 diabetes. So again, very important that you understand this, because a lot of people, the attitude around type 1 diabetes is that there's nothing that you can do about it, and that it's kind of a lot of the people that I've talked to that have type 1 diabetes actually get mad at me. And I don't know why, because they have this fatalistic attitude that because they have type 1 diabetes, there's nothing they can do within their diet, and that they have to be on insulin for the rest of their life regardless. Now, I don't disagree that insulin's an important thing for a type 1 diabetic to take. However, I will say this in my own experience, in dealing with type 1 diabetics, clinically speaking, a lot of times their need for insulin is dramatically reduced when they change their diet to a gluten-free diet. So we know that gluten plays a role and has an impact on insulin demand clinically for those that have type 1 diabetes. And I have seen one case in 21 years, now just one, so I can't speak for all type 1 diabetics, but I've seen one case of the reversal of insulin dependence in a type 1 diabetic on a gluten-free diet. So that doesn't mean that everybody can do it, but I have seen that happen. Quite a remarkable feat, in my opinion, because you don't ever read about those things in the research. So the other thing we know about diabetes is there's this connection with leaky gut. Now, one of the things we know about leaky gut is that gluten can cause leaky gut. And so that makes sense. Most of you are aware of that. But if you look at this diagram, one of the things that happens that we've researched is that bacteria produce chemical compounds and toxins. Okay, and let's change the color again. So I'm going to kind of draw these little toxins. Let's just say these other things here are bacteria, right? And they're producing these little toxins. Okay, and these toxins are leaking across your gut. These are gut cells here. These are gut cells, and this is a leak in between those gut cells. So we get these toxins leaking into the bloodstream. This is the blood on the other side. And these are called LPS, lipopolysaccharides. These are bacterial toxins, endotoxins, if you will, that when they leak into the bloodstream, it's been very well researched that they cause inflammation that contributes to diabetes. And that inflammation leads to production of cortisol and a dysregulation of insulin, and that those things, again, are linked to the contribution to blood sugar problems, that chronic inflammation. So again, remember, one of the risk factors for the development of diabetes is chronic inflammation, and that's what these things do. These bacterial byproducts leak across a leaky gut. The leaky gut itself can be caused by gluten. It certainly can be caused by other things beyond gluten, but gluten is one of the most common reasons this happens. And then those chemicals can create inflammation and cause dysregulation in how your body produces cortisol and insulin, which will disrupt your blood sugar. So we know there's a connection with leaky gut. Now, again, still talking about gluten here, there's another side that a lot of people say, well, I'm going to go gluten-free, and then they go to these rice and corn-based foods, these really toxic foods that really technically aren't gluten-free. And if that's news to you, you need to watch my master class, and we can put a link up for those of you who haven't had a chance to watch it. But the gluten-free food industry is ripe with rice and corn products, right? And these products are high carbohydrate, high simple carbohydrate, I should say, and they're high carb, and so they increase sugar in the blood. right? So these, even though they're labeled gluten-free, technically they're not gluten-free, but many of you are under the impression that they will still elevate your blood sugar. So again, gluten-free foods are not necessarily healthier than gluten-containing counterparts as it relates to diabetes or as it relates to highly processed sugars, carbohydrates, and other things. So if you're going and this is not just corn and rice either, by the way. So many of you are probably doing like these tapioca rolls or these arrowroot starch products, cassava products. These are all high sugar. And so, look, I'm not saying you can never have a tapioca roll or cassava chip. That's not trying to take away those things from you. But if these are your staple foods, if you are chomping these down on a daily basis, you're driving your sugar up on a daily basis, right? And so a lot of people think, oh, it's because it's gluten-free, it's somehow better for me. But if you're diabetic, pre-diabetic, or have a tendency toward blood sugar problems, and you just start eating these foods, and although they're naturally gluten-free, they're high in sugar, they're not going to help your diabetes, they're going to enhance it, or they're going to increase your risk for the development of diabetes. So keep that in mind, that gluten-free foods, like these ones up here, even though corn and rice technically aren't gluten-free but are labeled gluten-free, all of these things drive up blood sugar and contribute to major problems. So you have to be careful with those packaged food items. They're not good for you, and they can really damage your health. Okay, so let's talk about some of the nutrients, because these really are, in my opinion, these are keys for diabetes. So what are the biggest keys to reversing, diabetes? And really, when I say reversing diabetes, I'm really talking about type 2 and gestational diabetes more than I'm talking about autoimmune diabetes. Those are very challenging conditions. They can be improved. You can reduce your need for insulin, but the likelihood that you're going to reverse or cure that disease with diet and lifestyle change is very, very slim. But type 2 diabetes and gestational diabetes are completely reversible. Don't let anyone ever tell you any differently. These are diseases of lifestyle. So what are the lifestyle factors that we want to understand that are super important? And so number one is movement, exercise. We'll talk about why in just a minute. Number two is sunshine. Number three is adequate sleep. Okay. Number four is the right food. Number five has to do with chemical exposures, because these chemicals can oftentimes, these exposures to different chemicals also found in food, actually, depending on what you're eating, can create inflammation that can set you up, for diabetic tendencies. So these are five big ones. And then number six is over here is nutrition status. So vitamins and minerals, adequate quantities of vitamins and minerals. So let's go through this. Why exercise? Well, to understand exercise, you have to understand how blood sugar actually works. So let's do this. Let's draw you an image here. So what I'm drawing, that's too big. Let's make it smaller. I'm drawing you a diagram of, it's a very simplistic breakdown. So what happens, this is the tube of the lumen of the gut, right? So food's coming this way, and some of that food is broken down in your GI tract, and it's dumped into your blood, and in that we have glucose. So glucose dumps into your bloodstream, and when you get glucose in your bloodstream, it sends a message to your pancreas, and your pancreas is supposed to respond by producing insulin. Okay, And then insulin will traverse to a cell, to a keyhole, if you will, on the cell. So this is a cell. And insulin will snap into that receptor, and that will send a message through your cell. And there's a specialized door on the surface of your cells called a GLUT door. We'll just, for simplicity's sake, call it a glucose door. Okay, and so what happens is, let's back it up just a minute. So step one is what you eat. You're eating food that has glucose in it. Step two is that hits your bloodstream. Step three is that glucose, once it's in your bloodstream, messages your pancreas. Your pancreas responds in step four to produce insulin. Step five is insulin talks to the receptor. This is an insulin receptor. Step six, that message is transmitted across the cell and it opens up this door. Step seven, that glucose comes into your cell because now it can get in because that doorway opened. Before, when that door was closed, glucose was trapped in your bloodstream, and this is why blood sugar goes up. So once you get that glucose into the cell, you can turn it into energy. So you can turn it into cellular energy, otherwise known as ATP. And so this is a process that has to happen. It happens in everyone. Okay? And so this process, when you understand this process, you can now understand why sleep, we'll talk about why sleep, sunshine, exercise, and all those become very, very important. But before we jump into those, I want to plug in some of these nutrition issues, because these are nutritional complications. If you're not eating adequate quantities of nutrients, you can develop diabetes even if you're exercising perfectly, even if your diet is dialed in, even if you're getting plenty of sunshine and adequate sleep. So let's define where nutrients fit into this cascade. So right here at step 3, that step requires vitamin D. On the surface of your pancreas, you have more vitamin D receptors than on any other organ or tissue in the body. And these receptors require vitamin D. That's how your pancreas understands that it needs to produce insulin. So you've got to have adequate vitamin D for this message of glucose to communicate to your pancreas. And if you don't, all by itself, vitamin D deficiency can contribute to elevations in blood sugar. Insulin is a peptide, or it's a protein, right? And so the core or the center of insulin is zinc. Now you also need vitamin B12 to help the production of insulin, and you need magnesium to help in this as well. So you need these three nutrients to get insulin, but zinc is the most critical. Zinc is super important for the production of insulin. It holds insulin together. It's like the glue that binds insulin together. And then once you have insulin, you have this insulin receptor that it attaches to, and the insulin receptor is actually made out of vitamin B3 and chromium. And without those two nutrients, you can't form or properly produce insulin receptors. Okay, which means that this message never gets through to open this door. But something else you need to understand is that this message is done by, there are certain things that help with this message, and one of them is calcium. You need calcium for this message to work. You also need a B vitamin compound called inositol. Is very important for that message to traverse the cell also. So you need these nutrients to open that door, and then once glucose comes into the cell, it's then got to be basically stripped down and harvested into energy. And those of you that ever took biochemistry, you may remember a process called TCA or Krebs cycle. That cycle requires iron and copper. It requires all the B vitamins. It requires CoQ10. It requires magnesium. So it requires all these nutrients, again, to get at that final step, which is ATP or energy. So if you're low in any of these nutrients, it's going to impact or affect the way your body is either capable of regulating the sugar in the blood or generating energy from that sugar, which is what our bodies try to do. And this is one of the reasons why so many people go keto. This is how we use glucose as energy, right? Carbohydrate. How we burn fat as energy is a very different story. And so what happens a lot of times when people have overconsumed carbohydrates for so long, this whole process is broken, their blood sugar's up, they quit eating glucose, they reduce their carbohydrates, and their body starts burning fat as fuel instead. This is why it can be a kind of a catch gap or a stop gap for diabetes, and why so many people go keto and lose weight and they improve their blood sugar. It's because they're bypassing these steps. But my point is, you don't necessarily have to go keto if you look at these things and ask better questions, right? So knowing that you need these nutrients, the vitamin D, the chromium, the magnesium, the zinc, the B vitamins, the CoQ10, like all critical to be able to regulate blood sugar and to be able to get access to blood sugar. And what we know is that gluten can cause deficiencies of all of these nutrients. It's very well studied, very well documented. If you took my master class, I spent an hour, almost 2 hours on this topic of how gluten causes vitamin and mineral deficiency. And so we know this is one of the reasons why a gluten-rich diet can contribute so readily to blood sugar abnormalities and blood sugar problems. So these are all nutrients. Now, I mentioned earlier, I said we get back to this. Where does exercise play a role in this? What does exercise have to do with any of this? Well, one of the things that exercise does, it improves, let's use that color, it improves the sensitivity of insulin. So it helps insulin and the insulin receptor communicate better. The more lean mass you have, the more muscle you have, the better insulin is able to communicate to the insulin receptor. So in essence, remember what we said about insulin before? It's a key, and the insulin receptor is a keyhole. So exercise helps the key and the keyhole fit better. The other thing exercise does is it builds muscle. Remember what muscle is? It's one of the largest utilizers of glucose. In other words, your muscle uses vast quantities of glucose to generate energy on a daily basis. The more lean mass you have, right, the less glucose buildup occurs in your bloodstream because your muscle cells are using it. Even for your basic metabolic function, your muscle cells are using it. Why do we need sleep? One of the reasons why we need sleep is if we don't get adequate sleep, there's another hormone that will put the kibosh on this whole system, and that hormone is called cortisol. Without sleep, you have an increase in cortisol. The same thing happens when you have too much inflammation. And cortisol will travel to your liver, and it will ask your liver to break down its stored sugar, and it will dump more glucose into your bloodstream. So when your cortisol's high, it sends a message to your liver to dump sugar into your bloodstream. And if you're already struggling here with micronutrient deficiencies, this is why inflammation just increases the risk more and more for the development of diabetes. So we need sleep to regulate our cortisol. We need stress management to regulate our cortisol. We need the right food that doesn't cause inflammation to regulate our cortisol. All those things are important. And then we need sunshine, because we got to get vitamin D. This is one of the best ways that we produce vitamin D. So sunshine has kind of a dual effect here, right? It affects your cortisol balance, but it also affects your vitamin D levels. And so sunshine becomes very, very critical for blood sugar management and blood sugar regulation. Now, last I've heard, most doctors tell their patients to avoid the sun for fear of cancer. Did you know that vitamin D deficiency can cause 19 types of cancer? So, you know, your skin docs generally say avoid the sun and lather up with toxic sunscreen compounds that are known to contribute to cancer, while diminishing your body's stores of vitamin D, which is directly linked to 19 different forms of cancer. So to me, that's foolish nonsense. We got to get sunshine. It's critical for human health, critical for blood sugar control and cortisol regulation. So If you understand these things, you can take action. And so when I say diabetes is a lifestyle, right, we can get sunshine. Even if you've got fair skin, you can get sunshine to the limit that your skin is capable of tolerating it. You can go to bed on time. You can make sure you're eating nutrient-dense foods that don't create inflammation so that you're well nourished. And you can mitigate your stress to the best of your ability. And we all have stress that we can't control, but we also all have stress that we can control. So your job, your homework, is to find those areas of stress that you can control and get them under control. All right, let's dive into some of your questions. Let's see here. Wow. Does Simponi Aria affect glucose levels? So that's Simponi Aria is a type of drug commonly used to treat autoimmune disease. What that drug does is it can damage the liver. And so again, what we're talking about here, it can damage the liver. And so it can affect the ability for the liver to respond to high or low blood sugar levels. And in that way, it can contribute to blood sugar dysregulation. But by itself, it's more of an indirect effect on blood sugar than it is the drug itself causing direct elevations in blood sugar. Berberine and cinnamon and their effects on blood sugar. Yeah, so berberine and cinnamon. So cinnamon impacts this area right here, the insulin receptor. That's one of the reasons, or one of the ways that cinnamon improves insulin sensitivity through the receptor. Whereas berberine, a lot of the research on berberine, what we think, we're not 100% sure, but what we think is berberine acts here in this leaky gut manual, because berberine is a natural antibiotic, so it can wipe out bad bacteria that produce those LPS molecules. So we believe that one of the actions of berberine is actually on the GI tract directly. Okay. Does blood sugar control change during the menstrual cycle? I become very munchy as soon as progesterone levels rise. You're probably magnesium deficient. During the menstrual cycle, a lot of times that increased craving, that increased appetite, very much associated with magnesium deficiency, as magnesium is dropped or is lost as part of that menstruation cycle, as part of the blood loss as well. So very much could affect you in that way. What some women find very helpful is to take magnesium a week and a half before their cycle, and they find that those cravings are dramatically reduced. So Amelia, I don't know if I said your name right, Amelie from Australia. My dad has prediabetes. Should he cut out all carbs until blood sugar returns to normal? No, not necessarily. Again, going back to what I was just talking about, I don't think that it's necessary to cut out carbs. As a matter of fact, I think it's important to keep carbs in the diet unless you have other specific types of disease. I think carbohydrates are important. I think it's not more about cutting out carbs. It's about balance. So when we talk about, how many carbs what's the balance look like, right, on your plate, as a general rule of thumb, carbs, fats, and protein, we're talking about balance more than elimination. Adequate balance will reverse diabetes. Now, what some people do is, they largely cut out carbs, they go keto, and they do that for, let's just say, 8-12 weeks. They lose a bunch of weight, they feel better, they lose it faster. There's nothing wrong with doing that. Keto can be very beneficial that way, but I think long term, you want to come back around to trying to recreate balance. Don't stay there forever. So, if your dad wants to try keto, but where a lot of keto diets are bad, as it relates to diabetes, is cheese, dairy. Most keto diets, when people go on them, just kind of layman keto diets, is they massively increase inflammatory dairy. Now, for many people, you got to understand that dairy mimics gluten. Dairy has huge similarities. The protein casein in dairy has similarities to the gluten found in grains. And so a lot of times people go keto and their inflammation actually doesn't change. It stays the same. And so keto is not really ultra successful for them. They've lost weight, but they're still inflamed and their blood sugar is still not really being well controlled. So it's part of it is also how you choose to go keto, just the same way as how you choose to go gluten-free. A lot of people go gluten-free incorrectly and still continue to have health issues or contribute to additionally new health issues as a result of wrong food choices. So you got to be careful in the way that you go keto as well. If one takes chromium, is it necessary to take vanadium? No, it's not. What foods have vanadium? You can give a lot of your vegetables, mushrooms, spinach has vanadium. So those are really good food sources. Is metformin good to take as a supplement? Metformin's a drug. So in my opinion, no, it's not good to take as a supplement because it's not a supplement. It's a controlled substance and it doesn't come without side effects. Metformin will cause a deficiency of folate, B12, and CoQ10. Okay, and we don't want that, right? We don't want to have a deficiency of these nutrients. If we look at these two, side effect of deficiency is neuropathy. Well, what do diabetics oftentimes suffer from? Diabetic neuropathy. And one of the reasons why is because they've been on metformin for many, many years. We get metformin-induced diabetic neuropathy. Now, you can also have a diabetic neuropathy as a result of excessive glucose, hammering nerves, damaging nerves. That's possible too. But a lot of people that develop what they think is diabetic neuropathy, when we actually test them, their B vitamin, their CoQ10 levels are low, and therefore we're actually inducing a form of neuropathy directly. CoQ10 deficiency also causes congestive heart failure, which is another risk factor or comorbidity with diabetes. So, again, all drugs come with consequences. Now, some would say that the risk of taking the metformin because it reduces blood sugar, or rather the benefit of metformin, which is it reduces blood sugar, outweighs the risk of taking the metformin, which is diabetes complications. But I would argue that B12 deficiency and CoQ10 deficiency and neuropathy and congestive heart failure, those are complications. In my opinion, these complications are just as dangerous as elevations in blood sugar, and you could very easily not need this if you properly changed your diet. So no, I don't recommend metformin as a supplement. I don't recommend metformin really for anybody because, again, this is a disease of lifestyle, and lifestyle can be altered if a person is willing to make meaningful changes. Let's see here. Somebody's asking about air filtration. Yeah, so how does that relate to diabetes? So breathing in contaminated or bad air contributes to inflammation and disrupts cortisol. One of the best air filters, one of the ones I recommend, Emily, is called Air Doctor. I don't know if we could probably throw up a link for you if you'd like in the feed, and that way you can check it out. But actually, I have 3 of these units in my house. Let's see, can type 2 diabetes be just a symptom of beriberi? A long history of high carbohydrate diet? Where do we say, why do we call it diabetes? I think ultimately, what do we define diabetes as? It's really a great philosophical question, and I think medicine should be challenged on this, is that how do we define diabetes? Is it's an increase in blood glucose, fasting blood glucose, right? And if you look at the labs, most lab reference ranges are 60 to 90. Actually, used to be 60 to 90. Today, a lot of lab reference ranges are like 60 to 115. There's some labs that call normal of as high as 115. 21 years ago when I first started practice, 90 was considered the threshold or the cutoff. Today, it's 25 points higher in some labs. And that's, to me, that's alarming. So when you go to the doctor and you've had an elevation in blood glucose 3 consecutive times, they generally will give you a diagnosis of type 2 diabetes. Now, that being said, there's new testing now. There's one of the tests that's commonly being used called a hemoglobin A1C. And if you have a hemoglobin A1C that's higher than 5.7, they call that pre-diabetic. And you start getting over 6, and they're really putting you in a diabetic range. So that's how it's defined. So how it's defined is that you have high blood glucose. Well, what causes high blood glucose? Lots of different things cause high blood glucose. And that's the problem with the diagnosis directly, is that if we just focus on identifying what it is without identifying why it exists, and we medicate the what instead of asking the why, then we're really not serving humanity. We're not serving people at a higher level. We're actually making them dependent on medications, or making them think they need to be dependent on medicines for the rest of their life, when in fact they could just make meaningful changes to their diet. They could change their sleep, their exercise, their sunshine, their stress, their nutritional status. They could check to see if they have B vitamin deficiencies like B1 deficiency or CoQ10 deficiency or chromium deficiency. So again, it's asking the question why becomes more important, but I'm glad you asked that question. Yeah, I mean, another good point. Type 2 diabetes is diagnosed. This is an end-stage problem. At what point does blood sugar get high? It gets high later in the game. If we look at what does that mean? So like in the beginning, remember I said earlier, I said the pancreas produces insulin. Well, when your blood sugar goes up, triggers your pancreas to increase insulin output. And over time, insulin is desensitized, meaning it doesn't work as well. So the more your pancreas has to make over time, the less sensitive the insulin becomes. In other words, the less effective it becomes. Think of it, let me give you an analogy, kind of a physiology anatomy. When you put your shirt on in the morning, you can feel the fabric on your skin. You can feel it touching your skin. But as you wear that shirt throughout the day, your skin becomes desensitized to the sensation of feeling that fabric. Well, the same thing happens. The more insulin you make, the more you desensitize. You're desensitized to the insulin that you're producing. So over time, you become what's known as insulin resistant. Well, technically, this happens 20, 30 years before your blood sugar goes too high, right? So you're actually diabetic decades before you get a diagnosis, because the tests that doctors use to make the diagnosis are late stage tests. They only detect it in a late stage. They don't pick it up early. And so by the time you get the diagnosis, you've got decades of damage, of high blood glucose damage that's occurring to you, and that's not good. Can diabetes cause skin tags? Yeah, we've seen some relationship to skin tag formation. There's actually some thought that some skin tags can have a contributed by mold or by yeast overgrowth, which what happens when your blood sugar's high, elevations in blood sugar. So increased glucose in your blood makes your blood a petri dish. What feeds off of sugar? Internally, things like Candida. Candida is an opportunistic yeast that usually lives inside of the GI tract to very small degrees. But if your blood is too high in glucose and you have a leaky gut, then that Candida can migrate and it can go systemic, and it can create all kinds of problems. And there are a number of different issues: skin tags, eczema, other skin disorders, as well as increased blood viscosity, increased inflammation in the blood itself can all occur. There's actually a lot of really strong evidence and research too, showing that many cancers, this is why when you get cancer, they tell you quit eating sugar, right? Because Candida eats sugar, turns it into alcohol, right? Think about that for a minute. Your blood sugar's high, you've got Candida there. Candida is eating the sugar and it's pooping out alcohol. And now you've got to contend with both high sugar and alcohol and Candida byproducts, not even to mention that Candida produces something called an HWP that mimics gluten. And so if you're gluten sensitive, now you're reacting as if you're being exposed to gluten. You've got a chemical response in your gut and in your bloodstream that's causing excessive alcohol production that damages you. All these things can increase your risk for developing cancer. And some tumors on biopsy, when they cut them open, guess what they're finding inside? Mold and yeast. So is there a correlation? Is there a connection? There absolutely is. Again, this is one of the reasons why a hallmark recommendation for those with cancer as far as diet is concerned is to stop eating sugar, because it's going to perpetuate and feed the tumor. But does it do so through the feeding of Candida? Many believe that it does. There's some really compelling research that says that it absolutely, that's exactly what happens. Let's see, metformin will help lowering type 2 and 3. Yeah, it does. I mean, metformin is generally the drug that doctors prescribe to lower blood sugar in type 2, type 3 diabetes. Is there a connection or correlation between processed seed oils and type 2 diabetes? Yes, the connection is inflammation. Processed seed oils drive up omega-6, increase the inflammatory properties of the bloodstream, and then impact the way that cortisol and insulin communicate to each other. Question on how many carbs or grams per day for a healthy diet. It depends on who you are, Penny. So this is a good question. There's not a right one-size-fits-all to that question. If you're 150 pounds, your carbohydrate intake is going to be different than if you're 100 pounds. If you're exercising aggressively, your carbohydrate intake is going to be different than if you're not. So I mean, it's very dependent on other lifestyle factors. Most people that are trying to go keto try to stick to under 25 grams of carbs a day, but again, let's just take the average, the average person, let's make some room here. The average person who, let's just say, let's make it simple. Give me simple math. Let's say you're eating 1,000 calories a day. And what I said was the rule of thirds, right? So what is that? That's 333 calories of carbs, right? And so you divide that by 4, and that gives you grams. That's how many grams a day that you would eat if you're trying to get about a third of your total calories from carbohydrates if you're eating 1,000 calories. So let's say you're not eating 1,000, but you're eating 1,500. Do the math differently, and you can come to a basic, again, this is basic because everybody's a little bit different, but you can come to a basic math number of about where to look to start. Barbara, I have Hashimoto's and prediabetes. My doctor said that I am just as likely to end up with diabetes 1.5. Any research on a connection? Yeah, there is. We actually think that type 2 diabetes is autoimmune too, and that latent autoimmune adult diabetes they're very much similar conditions. So nobody can say with 100% degree of certainty at this point, but I do believe that there is definitely connection. Besides pharmaceuticals, why is insulin the go-to drug when nutritional deficiencies and choices can cause diabetes? That's a great question, Juan. And that's a question all of you should ask your doctors if that's what they're doing to you. If they're doing the go-to to the drug, but not having the diet or the lifestyle or the nutrition conversation, or not offering to test these things, it's the first question should come out of your mouth. Yeah, so another great question is, insulin is also a growth and fat storage hormone. Would exogenous insulin, meaning taking insulin through injection, be equally as harmful? So yes, I mean, one of the problems with overutilizing insulin, if you're a type 1 diabetic or if you're a type 2 diabetic that's become dependent on insulin, is that insulin actually has been shown, more insulin has been shown to increase the risk of many different types of diseases, including some cancers. So you want to minimize your need. Even if you're type 1 diabetic, you want to use the least amount of insulin as possible. Unfortunately, in nutritional management of diabetes, whether it's type 1 or type 2, so many nutritionists tell you to eat sugar to get yourself out of a glucose, a hypoglycemic episode. Or if you take too much insulin by accident, they tell you, oh, eat some hard candy or drink swill down a big glass of orange juice to balance it out. Like, their management strategy sucks, frankly, and it creates a lot of harm to a lot of individuals. And what should be emphasized isn't chase your insulin with candy or sugar. What should be emphasized is have a diet and a lifestyle and a behavior pattern that minimizes your need to inject yourself with insulin. Now, again, I'm not telling you to get off of your insulin. I'm not telling you you don't need insulin, but you might need a lot less if you were doing things better for your body and taking better care of your body. I mean, it's a pattern I see over and over again, including in type 1 diabetics. I don't know about sumo wrestlers, Mark. The question is, sumo wrestlers eat 6 big bowls of rice, or eat big bowls of rice 6 times a day. Are there any sumo champions who are gluten-free? I don't know. I don't follow sumo competition. Can statins, low salt diet, and or chronic stress cause type 2 diabetes? Statins can cause CoQ10 and vitamin D deficiency, so they can certainly contribute to nutritional risks associated with the development of type 2 diabetes. What's worse, too much fructose, glucose, or galactose? It's not which one is worse, it's which one are you doing consistently too high. I wouldn't say, one is worse than the other. They all have purposes. But any of them in overabundance for too long can create problems. My big toe is numb. Nancy from Montreal. My big toe is numb. Can that be diabetes? I eat gluten-free, don't eat sugar. My doc told me I'm diabetic with my blood test, 2-hour glucose, but she didn't treat me. She says it's not too much for now. She'll check back in 6 months. So, yeah, I mean, you could have your numbness in your toe could be, it definitely could be a kind of an early warning symptom of blood sugar elevation. Don't rely on a glucose tolerance test or an insulin let's just talk about that, because a lot of you go to your doctor, and what do they measure? They measure your blood glucose, and then they say you do or you don't, right? So there's glucose, there's also insulin, there's a hormone called C-peptide, there's also CRP, there's another marker called ESR, and really, if you're trying to understand whether or not you have a blood sugar problem, despite whether or not your doctor wants to give it the name of diabetes, doing all of these tests, and the reason I mention these are all standard labs. Anybody's doctor can run them. Most doctors are familiar with them. It's not like some of the more advanced testing that I might run if you came to see me, but these are things you can ask any doctor to run, right? So your glucose, generally between 60 and 90 is what you want to look to see it fall at. Your insulin, ideally, you want your insulin to be under 10. And these are fasting markers, by the way. C-peptide, generally speaking, somewhere between 3 and 4 is a pretty good range for it to sit. And then your C-reactive protein should be under 3. And then your erythrocyte sedimentation rate should be under 20. And so what happens, why we're looking at these different things is that ESR, erythrocyte sedimentation rate, C-reactive protein, these are markers for inflammation. And so if you're chronically inflamed, it's going to drive up your blood sugar due to the inflammation. The C-peptide is measuring how well your pancreas is capable of producing insulin. The insulin is the outcome of what you're producing. And what happens is a lot of people are 20 plus. The reference range for insulin on most labs today goes up, on some labs it goes up to like 28 as still normal, but it really, in my opinion, anything higher than 10 is problematic. You're pushing yourself into insulin resistance range. So, a lot of times your insulin could be 22. Your doctor says, it's normal, don't worry about it. In my opinion, you're in trouble if you're over 20 on your insulin. And then again, as I mentioned earlier, with your glucose at 60 to 90. So these are all labs. Again, ask your doctor to measure them and kind of see where you fall. And if you're 90, let's say your glucose is 99 and your insulin is 15 and your C-peptide is 1.5, so it's too low, you're not producing well. Let's say your C-reactive protein is 8 and your ESR is 33, right? Just again, throwing out numbers. You're diabetic. Whether they give you the diagnosis or not, this is a pattern that would represent that your blood sugar's out of control, even though on some lab tests, glucose at 99 is considered to be normal. So part of the problem, you have to understand, part of the problem in lab reference ranges is the labs alter the reference ranges periodically. And what we've seen in industrialized countries over the past 20, 30 years is as the population obesity rate goes up, because right now we're sitting at an obesity rate of about 50%. Now, if we go back 30 years, we have an obesity rate closer to 15%. Well, if I'm a lab company and I'm drawing blood on people and it's, 20 years ago, 30 years ago, and the obesity rate was this low, I'm going to have a lot less diabetics in that population. And so my reference ranges are on average going to be much lower, like the 60 to 90, right? But as obesity goes up, right, and I'm taking these individuals and I'm recalculating my reference range, because even though these people don't have a diagnosis of diabetes yet, we're still calling them normal even though they're obese. So we're normalizing obesity, which is a mistake, and we're recalculating reference ranges based on unhealthy people that don't have a formal diagnosis yet. And this is why the glucose reference ranges now go as high on many labs as 115 as still normal. When 115, again, anything really over 90, I would consider to be diabetic or pre-diabetic. But most of your doctors, they don't think this deeply, and they don't go into this deeply. Because why? Because they don't study nutrition. And what is diabetes? It's a disease of nutrition. It's a disease of nutritional mismanagement. It's a disease of biochemical nutritional mismanagement. And if you don't study nutrition very well and you're trusting the labs and trusting the reference ranges, as many doctors do, they just trust that the reference range is right. They don't question where it came from. They don't ask why that reference range exists or why this lab has one range and another lab has another. And they just hand you yeah, you're fine. We'll wait 6 months until you become majorly diabetic, and then we'll start doing something about it. So let's let 6 months go by and 6 months of damage continue to wreck your health, and then we'll start doing something about it. So hopefully that answer gave you a little bit of clarity. Why is my type 1 diabetic son always hungry? He eats good, but then he gets hungry and thinks he needs more. I mean, it's probably because he's growing. And if he's active and growing, I mean, kids, oftentimes their appetites will fluctuate and change, not as much. Adults can have more of a stable appetite than children, but children go through growth spurts, and a lot of times they will get more hungry. Let's see, I ate primarily keto foods and my A1C kept going up. Can you expand that question? I can't see the whole of it. There it is. My A1C kept creeping up on a keto diet. I was worried I was getting type 1 diabetes. I started cycling, nutritional cycling of low carb, and my A1C finally went down. Why? I am grain-free, completely eating organic, only in various supplements. So if you start, so define what you mean by nutritional cycling, Carol. If you're talking about something like an intermittent fast, sometimes that is what's necessary in order to break through. If you're talking about nutritional cycling, meaning going back and forth between keto and carb, that can also be something that helps a person break through, metabolically break through, and utilize energy more efficiently and bring blood sugar down. But clarify your question for me, and I can give you a better answer. Let's see, Mary Jo, I read that wild rice is not a grain, but not sure if that's true. Can you clarify? Yeah, wild rice is not a grain. It's an aquatic grass. So technically it is gluten-free. I'm hypoglycemic and eat a lot of vegetables, some fruits, nuts, and seeds, as well as some meats. Are those carbs easily converted to sugar? It depends on your metabolism. I mean, the carbs that are the easiest to convert into sugar, a lot of your root vegetables that are starchy in nature, and a lot of your fruits that have a higher glycemic index, generally speaking, are easier to convert directly into glucose. Let's see here. I think, no, not a question there. I'm type 1 and very skinny, but seems always I have indigestion. Very careful with the diet. Why do I have indigestion? Beverly, there's a lot of reasons why you could have indigestion, even beyond the diet. There could be a bacterial overgrowth or a yeast abnormality within your GI tract that's creating that indigestion. It could be that you're eating foods that are more challenging for you to digest, even though you're not allergic to them. You know, classic example that we'll sometimes see is people over-consuming animal proteins or meats when genetically they're not matched for that, and so it can give them indigestion. I mean, there are just too many reasons to list there. Can cutting out gluten decrease high antibodies numbers with Hashimoto's? Absolutely, Marley. I've seen gluten take Hashimoto's antibodies completely to normal. Gluten-free diet, rather, take Hashimoto antibody to completely normal. Let's see. What about taking Lyrica and Cymbalta for nerve pain? I mean, it's a good question. I mean, you can, your doctor prescribes those. Those are common medicines used to treat nerve pain, but, did you ask why you were having nerve pain? There are different reasons why nerve pain can exist. And so if it's a diabetic neuropathy, using those medicines doesn't solve why the nerve pain exists. However, if you've got traumatic nerve pain because you were in a car accident and your nerves are lit up, it might not be the worst thing that you do to take Lyrica or Cymbalta for nerve pain. I've seen cases where it was helpful for people post-traumatically for a time. So it's not that all prescription medicines are bad per se. It's just a matter of why do you have nerve pain in the first place. I think if you can answer that question solidly and know what the answer is, and if the answer has something to do with diet and lifestyle, then you should adjust diet and lifestyle as a predominant, first line of action, as opposed to relying on medicines and or supplements to mask your symptoms. Okay. Well, we got way more questions than we have time. Yeah, keep going down. How to heal from Candida? It's complex. That number one way to begin that process is to eliminate easy accessible carbohydrates from your diet. Go on a low yeast diet because Candida thrives on sugars, so you want to starve it out. So if you've got Candida, you definitely want to starve it, but it's also smart to make it difficult for it to survive. And so one of the best supplements I've found to balance the gut from a Candida issue is caprylic acid. Can be very, very effective in that regard, and also a really strong probiotic that has something in it called Saccharomyces boulardii. It's a probiotic that helps to fight Candida because it creates competition for its growth. So again, the strategy: starve them out, make it uncomfortable for them to stay inside of you. You can use caprylic acid to do that, and then a probiotic called S. boulardii. All really good places to start with, with diet lifestyle on the Candida front. And of course, alcohol can never be consumed if you have Candida. You'll never get it to go away if you're drinking any kind of alcohol at all. Can microbiome dysbiosis cause non-alcoholic fatty liver? It absolutely can. There's a number of research studies that have confirmed that is a direct correlation, that those things can go hand in hand together. How much sugar is too much? Define sugar. If you're talking about processed sugar, you shouldn't have it. If you're talking about natural sugars found in food, then again, it's different for different people. And it depends on your activity, it depends on your exercise, it depends on your body frame, it depends on your metabolic type, it depends on your muscle mass. A lot of variables in that question. If you can't get in the sun in the winter or the rain, is there a substitute light source you can buy or use? Now, a lot of you are going to freak out when I say this, but tanning bed. And I'm not a fan of going in the tanning bed and getting tan. I am a fan, though, in the middle of winter, if you have zero access to sun and you live in northern climates, that 2 to 3 minutes in a tanning bed a couple of times during the middle of winter can be life-changing in terms of helping your skin generate vitamin D that's quite necessary. So that's one way that you can do it. And that will help also with melatonin production. The happy lights are something people use, and happy lights are great during winter months. They're not UV, so they're not going to produce vitamin D from your skin, but they will help your eyes produce melatonin, and so for some, stave off the winter depression, but isn't going to do anything for your vitamin D. Some of these questions are so specific. So if I don't answer them, it's just because they're so specific that really requires a relationship. It really requires me to know who you are and know more about you. And otherwise, it's just very challenging because there's just too many variables in some of these super specific questions. Good sugar substitutes. Holly's asking about what sugar substitutes are appropriate to get candida under control. Probably one of the better ones is that won't really feed candida. Monk fruit is a good option, and then xylitol, but specifically birch xylitol. Don't go for just any xylitol. You want birchwood. And the reason why is most forms of xylitol are made from corn, and so you want to make sure you're buying a birchwood version so that you're not getting the exposure to corn, in your alternative. Let's see, go down on the left. I'm sorry, I'm at the right. Yeah. Can pancreatitis cause diabetes? Yes. Can diabetes cause pancreatitis? Yes. There's an inverse relationship between the two. Is it wise to take a multivitamin as well as the vitamins and minerals individually? Yeah, it's not unwise, Carolyn. It just depends on the person. Generally speaking, in an ideal world, people should get nutritionally tested as a minimum every 6 months. That's in an ideal world. And I know we don't live in an ideal world, but I put people all the time through testing, right, on a multivitamin with individual nutrients that they have major deficiencies in. It's very safe to do. I mean, as a matter of fact, nutritional supplementation is one of the safest things in the world that you can do with little to no side effects for the most part, unlike medicines. Let me just, you always say money, you can always follow the money and you kind of get your answer, right? Well, let's look at how much money does a medical doctor spend on malpractice insurance because the risk of medications and dispensing medications is so high. The average medical doctor, depending on their history and how many claims they've had made against them, will spend really no less than about $20,000 a year on medical malpractice. That's a lot of money. You take a nutritionist who's purchasing malpractice, the average amount they'll spend is anywhere between $1,000 and $2,000. I mean, that's a 20-fold difference in what it costs to insure those different practitioners for malpractice, for the potential for them to do damage, which tells us one thing, that vitamins and minerals are super safe and don't require a huge amounts of dollars to cover somebody insurance-wise, whereas medicines have huge risk-benefit ratios that have to be accounted for, which is why it's so expensive to insure those doctors who are writing those prescriptions. Benjamin asking about cellular testing long distance. Most good cellular testing, Ben, for nutritional deficiencies, it's got to be to the lab within about 24 hours. So, it's harder to do if you lived in Australia, for example, and you were trying to ship it to a lab in the US. It's a lot harder to get that to happen. And so, yes, you would lose validity of the test the more aged the blood becomes. And that's intracellular levels that we're talking about. Let's see. Your warrior bread at the start of today's session makes the statement, bread is back. Do we assume that will typically often be grain-free, especially in light of today's topic on diabetes? Not sure I understand your question, but warrior bread is grain-free, and it's relatively low glycemic and high fiber, and I designed it that way on purpose so that, so again, that people could have bread and not fear, the blood sugar spikes. Okay. Gosh, the questions just keep coming. I don't have time tonight to get through them all because we're already 22 minutes over. Hey, look, I just want to say thanks for joining me on a Monday night. I know you've got a lot of choices to make, and just the fact that you're here with me means a lot. So thank you for joining me. I'd ask you for a favor in return. If you're new to the show, go over to Gluten Free Society. Make sure you subscribe to our free newsletter. We'll send you tons of great information, let you know how to access all of our replays. We've got over 1,000 video tutorials online that you can get access to that might have the power to impact your life in a major way. The other favor I'd like to ask of you is share this information. Our goal here at Gluten Free Society is to help save 100 million lives, and the way we do that is grassroots. We do that through conversations, the conversations you have with your mother, your father, your loved ones, your children. So share this information, share it far and wide, and together we can all help save 100 million lives. Have a fantastic week. We'll see you next Monday for another episode of Pick Dr. Osborne's Brain. Take care. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.